The patient looked stable. Vitals normal. Oxygen okay. Heart rate calm. But at exactly 2:13 a.m., she grabbed the nurse's wrist and whispered, "Please don't leave. Something bad is about to happen." 3 minutes later, the entire ICU exploded into alarms. And what happened next still haunts the night staff to this day. Her name was Elena Brooks. 46 years old. Admitted for what doctors believed was a mild pneumonia case. Nothing unusual. She joked with nurses. Texted her daughter. Even asked when she could go home. But Nurse Riley noticed something strange. Elena kept staring at the heart monitor. Not nervously. Not confused. Almost like she was waiting for it. Every few minutes she'd ask, "Are you sure my heart looks okay?" The doctors reassured her. EKG looked fine. Blood pressure stable. No signs of cardiac distress. But Elena wouldn't relax. At around 1:40 a.m., Nurse Riley brought her water. That's when Elena quietly said, "Do patients ever know before something happens?" Riley smiled politely. Sometimes anxiety makes people feel that way. But Elena shook her head. "No. I mean really no." The room went silent. Machines humming softly. Rain tapping against the ICU windows. Then Elena said something Riley would never forget. "It feels like my body is saying goodbye before I'm ready." At 2:10 a.m., Elena became restless. She adjusted her blanket repeatedly. Her breathing changed slightly. Still, the monitors looked normal. The resident doctor suggested mild anxiety medication. But Riley hesitated. Something felt off. Not medically. Instinctively. At 2:13 a.m., Elena suddenly grabbed Riley's wrist tightly. Her eyes filled with panic. "Please stay." Then she whispered, "I think my heart is stopping." 3 minutes later, the monitor screamed. A violent alarm shattered the silence. Heart rhythm crashed instantly into ventricular tachycardia. Then worse. VFib. Elena's body jerked against the bed. The code blue button slammed. Doctors rushed in. Crash cart wheels thundered down the hallway. Someone yelled, "Charging to 200. Another voice. "She has no pulse." Riley stood frozen for half a second. Because Elena had known. Before any machine did. CPR started immediately. One shock. No rhythm. Second shock. Still nothing. The room became chaos. Monitor alarms. Oxygen masks. Medication syringes. Doctors shouting times and doses. Riley looked at Elena's face. Just minutes earlier she had been talking normally. Now the room felt unreal. Then suddenly, a rhythm appeared. Weak. But real. Someone shouted. "We got her back." The entire room exhaled. But Riley couldn't stop thinking about Elena's warning. Hours later, cardiology discovered the truth. Elena had an extremely rare electrical instability in her heart. Hard to detect. Easy to miss. It can appear normal, until the exact second it becomes deadly. The doctor said if staff had ignored her worsening anxiety completely, she may not have survived. Because Riley stayed in the room, they reacted seconds faster. And in cardiac arrest, seconds matter. 2 days later, Elena was recovering. Weak, but alive. Before transfer out of ICU, she asked Riley something chilling. "Did I really say my heart was stopping?" Riley nodded slowly. Elena looked down at her hands. Then whispered, "That's strange. Riley asked why. Elena replied. Because for a moment, I could actually feel it fading away. Some nurses say patients can sense when their body is changing. Some doctors call it coincidence. But everyone working that night agrees on one thing. Elena knew something was wrong. Long before the machines did. And if Nurse Riley had walked away, this story would have ended very differently. Subscribe for more hospital stories.